Hi, this is Ed Tracy, and I'm here with Dr. Patel, and we're in the wellness clinic that Dr. Patel owns here in the Vigo County area of Indiana. And this is actually the first clinic that you opened?
That's correct.
And this is for the Vigo County School Corporation. And we've already covered some of the different topics today. We met with the human resource director, former human resource director of the county school system, and we met with the current manager of the health and human services for the school system, and we've also met with the sheriff of the county. We've also met with a private corporation that serves the auto industry, and it's been quite a day. You've got a lot of fans out there.
Thank you.
And everybody that we met, we've interviewed people. We had breakfast with county commissioners, and then we had an interview with the county commissioners, and then we had lunch with the other groups, and we interviewed them. And I will tell you, either there's something in the Kool-Aid here, doctor, or you've got a great program. And maybe have solved the access to care problem that we've had in the United States. And so I come from Georgia. People watching this will be watching it in Georgia. And you're a native of Georgia that moved to Indiana.
That's right.
And so I'm glad to have found you up here, and hopefully people back in Georgia will see this and will see there's a solution to the boundaries right now to have access to health care. And that's what we hope to do with this series and why we came all the way to Indiana to do it. So Dr. Patel, tell us a little bit about what you'd like to talk about in this segment. You know, we've covered an awful lot of ground with all the different interviews and visits, and this is the second clinic that we visited today. You know, the staff, we've even talked to staff. They even like working here. You know, I think Tiffany, one of your nurse practitioners at the other clinic, said she had worked in an ER, and
that's right.
She said this is just what everybody has been looking for. So we keep people out of the ER that don't need to be in the ER. And we've got productive employees, and we've got cost savings to counties and governments, and now a business. So I guess I can just close the camera down and go home. It's settled. So tell us a little bit about, you know, what you'd like to cover in this segment, and what you'd like people to know back in our home state of Georgia here, and how you'd like to see people around the country develop this.
You know, I think as we talked about, this is mainly designed for the self-insured company owners, and they're essentially providing care for their employees and their individuals who are on their benefit plan, the spouses and the children. What is unique about this facility, though, once we opened up, we realized, I mean, that was a primary focus. You know, how can we get this care out to the private sector who are self-insured and give them access to care, because they're paying for care. Once we started coming into the workforce and realized that it is not a normal clinic. I mean, we don't operate like a normal clinic, and here's why. For example, let's say I started this practice, and I'm becoming busier. I see 30 patients a day. Now I need to hire someone, and I hire a physician assistant, let's say Ken Massey. When I hired him in a private arena, I would hire him 9 to 5 Monday to Friday. So 2 providers are working Monday to Friday.
And both 9 to 5?
Both 9 to 5. Really, that's selfish. That's providing my schedule and my partner's schedule. If truly we were servicing the employees, the patients' needs, and looking at their needs first and putting them first, guess what we should be doing? Ken Massey, my new hire, will be working 5 p.m. to midnight, work weekends. I'll continue working 9 to 5 maybe, or vice versa, but the point is we should be working together 40 hours a week. We should be working 40 hours, and overlap, so our lights are on 80 hours a week. Then our patient population has access to us a longer period of time in the week. I mean, by default, pretty much they'll get us, you know, if you keep the doors open 80 hours. But traditionally, the healthcare system is to serve the physician. I was in that boat. I did this. I'm guilty of this. So, but I think I realized that this is not the way to service the consumer, which is the patient. I mean, another example. We say on-call. It really, 50 years ago, was there anything like on-call? There's no such thing as on-call. It was, you just call your doctor, however you got a hold of him. He is your doctor, not on-call for covering for someone.
Right.
He is your doctor, 7 days a week, 365. And that's the way it should be, if you really think about it. Because today what happens is if I have a group of 10 physicians, and I take call every 10th day, then 9 days, my patients don't get me. And when they're sick, they don't want to talk to my partner.
So only 10% of your patients actually ever get to reach you.
Based on my practice size. But here what we do, we practice, is that they can call us directly. Every patient leaving this center, every patient will get a business card with my cell phone number and my partner's cell phone number right next to each other. And then there's an 800 number that they can reach us 24/7, based on between him and I. So
even though 80 hours is what you're trying to be open, you're actually access even in those closed hours.
Correct.
People still have you, and they get you or they get Ken, but one of you is somebody who already has a relationship with the patient. They have a relationship and a level of trust and comfort with you, and you don't have a doctor guessing who's talking over the phone. You have a doctor who's already seen them, known them, and you don't have to worry about whether they're over-prescribing something or under-prescribing something. So there's a lot of benefit to that, and like you said, 50 years ago, you reached your doctor.
Right, exactly, and we're actually taking those steps now. So, for example, this Sunday, a patient called up, and Ken came here, opened the clinic, and saw the patient, and Ken is on his way, and the patient's on their way. Or it could have been an ER visit. Ken didn't need to do that. But you know what? Ken's boss is not me. Ken's boss is the patient. Patient needed him. So he actually came down here, saw the 2-year-old baby with the mom, and treated the baby, and they went home. Or it could have been a 4-hour wait in the ER, another 2 hours inside the ER, and a $900 bill. Versus a house call, basically, that we made. And that does have a cost inherited, but the company owners see it as a savings. And they feel like if they made 10 house calls, they prevented probably 7 ER visits.
Right.
And
because an ER visit would be $2,000
exactly.
and more.
Exactly.
And you know, the cost to the county here is a $200 bill. And right now, under the model of those counties that do not offer this service, they're paying the $2,000 bill.
Correct. Exactly.
And matter of fact, the doctor on their plan is referring them to the ER. So the doctor is advocating for the emergency room higher cost with no benefit to the providers, to the patients, because the patient's costs are higher in an emergency room in the copay area as well. And we've talked about that at length.
Exactly.
So you're serving your patients in 2 ways: A, access; B, cost effectiveness. And the barriers of access have been totally removed in all ways. Access because you are available 24/7, you and your staff, and access because they don't have to wait till the next paycheck and be sick for 2 weeks before they get help because they're worried the co-pays of medicine, doctor's visit, labs, all of a sudden it's a $200 bill, they don't know how they're going to pay it.
I agree, exactly. And you know, the other component, we talked about access and cost savings for the employer, but the third piece we got to add into this is very important, is a quality component. And I'll give you an example. Let's say you had to get an MRI of your knee. Sports injury, it's swollen for a couple of days, you go to the orthopedic surgeon, you put a splint on, didn't work, let's get an MRI. Okay, well, you come to this clinic, let's say, and you say, look, I gotta get an MRI. And we will say, no problem, go get the MRI at this facility here in town, and they will upload those films into our telemedicine technology platform. And when we get those films, then we will take those films and beam it to a physician, a radiologist, who predominantly reads joint MRI. Day in, day out. He's a specialist in joint MRI.
Might be in another state.
Might be in another state. So I would be able to fine-tune these specialists and contact them in a pre-existing...
Well, wouldn't that take weeks to get it back?
Not at all. Not at all. Actually, in fact, we already have these things pre-designed, so we know exactly which radiologist is going to read which films based on the case study. So we'll say Dr. X is going to be reading the joint film for you, for your knee, and it gets shot out to another state, wherever it may be, and then he or she will then give us the results in a matter of hours. And now I can go to you, Ed, our patient, and say, we had your MRI read by the best radiologist in the industry that reads only joints, not head to toe. So you got the best quality care, number one. Number two, I feel as a provider, as a physician, not a business owner at this point, as a provider of care, I can drive home and say, I took care of Ed.
So somebody watching this now will say, well, if you hired the best, you must be paying more for that.
That's what one would think, but no. We can get that film produced in town, beamed into the technology platform, beamed to the specialist, and comes back about 110% cheaper than what it costs to do it right here in town.
Wow.
And the rationale is that we have buying power, purchasing power. We do X amount of x-rays, X amount of radiology films or imaging films, and we will get a discounted rate based on that. And the specialist will charge more, but the savings up front, getting the films, offset some of that expensive read, but together it's an overall savings.
And there's a savings in having it read accurately the first time, and not having to go back and take another MRI because something didn't look clear, or the wrong person read it who didn't have experience with that particular part of the body. Or and I think that's specialization is where medicine has gone over my lifetime and your lifetime, and the quality of care goes up when specialists are involved because they see that day in, day out, and so they can recognize things. So are you just a triage center for these specialists, or are you actually providing care?
Sure. I always view this as a ground floor in the healthcare system. The ground floor, the base, and you got to have a good foundation, good base. If you have a solid base, then you can keep everything stacked up just right. So our thing is we want to make sure that we provide care to all our patients in terms of primary care, annual physicals, screening exams, mammograms, pap smears, and the colonoscopy type of screening exams. And whenever we need the patients to utilize the specialist, then we'll navigate them through the system based on quality metrics. Not based on yellow pages, you just open up and find the first physician available for that specialty, but we can actually pick up quality metrics on most of the physicians in town.
So unlike some healthcare plan that goes for the cheapest doctor in town, who's willing to take that $25 for a $150 exam, this is more of you seek out the top 10% of the doctors in that specialized field, and therefore you're advocating for a better quality of care in life for your patients, because you're going to benefit your patient. You're always out there looking for the best care, the best doctors, and the patient really builds up trust that you're not just trying to save the county money.
Right.
And that would be something where you couldn't build trust if the patient thought he's just getting the cheapest care he can find for us. Instead, you're actually finding the best care available in the state, in the country, whatever, for the specialized areas. You take care of all the basic needs here.
Exactly. And you're right. I think the key thing is this is quality focus, and at the same time bargaining rates based on purchasing power, and understanding the business model too. Once we understand the business model for the radiology groups, the specialist group, then we can negotiate in a certain way.
Right. Well, that's pretty pretty amazing. All the testimonies that we had today were very amazing. I thought, you know, I've been in political life for 35 years, and to hear elected officials and your county sheriff and all that advocate so strongly, there was no gray area today. There was, you know, they have a history. They knew 5 years ago what it was like.
Right.
And they know what it's like a year, 2 years later now. You know, the school system almost 2 years later, the county almost a year later, and they've already seen change and a difference. And the private industry gentleman said today, he said, we've seen a difference in morale in our company.
Right.
If you can, as an HR person, solve a morale problem and get better health care, boy oh boy, you're really a win-win in the workplace. So, is there any other area that you wanted to cover in this last segment that we're going to have with you today?
Well, I think maybe talking to the nurse and our physician assistant provider will give you a patient experience too.
Yeah, we'll do.